Hello, Dr. John Bartemus here today with Heidi, and Heidi wanted to share her story with us. So Heidi, why did you first seek out functional medicine care?
Really just wanted optimal health, no specific issues. I just want to be the best version of me. And I always knew that modern medicine doesn't necessarily do that. It's more of a respond when there is an issue kind of thing, and not let's make sure we don't get issues. I realized that through friends and family that, get diseases that, why isn't this caught, before this becomes an issue?
Right, yeah.
So I wanted to make sure, that I could do everything I do from a preventative standpoint to not get issues and, not have to rely on modern medicine. So, just want to do that. I knew that inflammation was the biggest predictive disease, and I had no idea what my levels were.
Yeah.
I felt fine, but I wanted to make sure that, I could have minimal inflammation in my body, so as that would be the driver. That is the driver for kind of a lot of disease. So again, just best version of me.
Awesome. So Heidi is a unicorn in a medical practice because most people, again, don't come until they have the issue. So for someone to come in proactively and say, hey, I just want to be optimal, that's like, yes, So thank you for having that mindset, and that's the mindset that really, if America had, it would look a lot different. So in your experience through the process, did you have inflammation even though you felt good and didn't, couldn't necessarily tell that you did and just wanted to optimize? So what did we find?
My numbers showed that I had inflammation. It didn't necessarily have, I didn't have the brain fog or stuff like that, so I didn't have any real symptoms, but to me it was like, oh boy, I guess I do have some. The numbers showed that I did have some, a good amount actually, based on, the way the numbers read. Creatine was one of them, and CRP, yep, and then, some things with the stool test as well. So that's what I want to get rid of. I guess not necessarily scary because I didn't have a disease, but it's scary in the sense that, like, wow, I have this level of inflammation, I don't have symptoms.
Yeah.
So
what
it's
are
great
they when you do have symptoms?
Yeah. So it's great to be able to figure out a plan to be able to get that down.
Awesome.
Before it could ever be an issue.
So Heidi is a good example of feeling isn't function, right? Because she felt great but had high inflammation despite that. So if you're out there and you want to be a rock star like Heidi and optimize your health and understand whether or not you have inflammation, even if you lack symptoms, reach out at functionalmedicinecharlotte.com.